my name is Glenn Carlson, and I'm going to talk about the history of paramedics and emergency medical services. Myself, I'm a paramedic. I've been a paramedic for 22 years, so I have a little insight on it. Have you ever had to call 911 for an emergency or call if you're a family member? Chances are you've come in contact with a paramedic. Have you ever been to an emergency room or a clinic? Chances are you've come in contact with a paramedic. Paramedics are everywhere, and they provide emergency medical care. In this speech, I want to tell you about these rescuers and how they became about. On this whiteboard, we have a little bit to show you. In 1865, the first ambulance was run. It was by the U.S. Army, and it was just two drivers. It was almost like a truck. They would pick up the injured and take them to the hospital. There was no real care provided. In 1869, the first city ambulance was done in Bellevue Hospital, at a Bellevue Hospital in Manhattan, and it was run again by ambulance drivers. 1926, it became a little bit more official. The Phoenix Fire Department actually started responding to medical calls. They didn't carry a lot of equipment, it was very basic stuff, but they did respond to medical calls. In 1966 is really where it started to evolve. In Belfast, Ireland, a coronary care unit, which means for heart problems, there were specialized people specializing in sick and injured people that were having heart attacks or heart-related problems. In 1968, St. Vincent's Hospital in New York City ran the first coronary care unit here in the United States. In 1969, right here out of Miami, Florida, the first paramedic program was actually put into use. In 1993, the paramedic role was expanded. Initially, it was just for heart problems. Now it's expanded to pediatrics, obstetrics, trauma. It really encompasses a lot of different things. A paramedic is the most advanced medical professional that you'll meet pre-hospital, outside the hospital. Educational requirements for paramedics have evolved tremendously over the years, from just a couple of hours in the classroom to now there's actually different levels. There's emergency medical technicians, and then there's paramedics. Emergency medical technicians basically put band-aids on people. Paramedics carry drugs and life-saving equipment. Basically, a paramedic will do everything for you in your home that a doctor will do in the hospital, so we're bringing that care to you quicker. Nowadays, the educational requirements for a paramedic are you need to be state certified as an EMT, you need to have experience in the EMT, and usually it's 9 to 12 months in undergraduate work at a college. Paramedic skills are many. They include airway management, they include heart conditions, they include a multiple of drugs that we administer pre-hospitally. It includes patient assessment, understanding how to assess patients. And it also includes wound management, some type of trauma if you have a broken bone. It also includes obstetrics, OB people, and it includes pediatrics. So really it's everybody nowadays that paramedics come to help and come to treat. Employment for paramedics are many. You'll find paramedics in emergency rooms. When you go to the hospital now with the staffing of nursing, with the nursing staffing down, you'll find paramedics in the ERs. You'll find paramedics on ambulances. You'll find paramedics in fire departments. Fire department is actually one of the areas that I work for. We're actually a combination, you can see on my helmet, firefighter, paramedic. So we do not only firefighting, but we also do paramedic work. We work in doctors' offices. We work in emergency clinics. We work on helicopters. We work on airplanes, transporting patients. We work for the police department with regards to SWAT teams and private security. So there are many, many settings that you can find a paramedic in. I myself have also done remote work in, we've brought medical clinics in jungles and in very rural areas where there are no doctors. We've brought healthcare to those people. In conclusion to this, I really just wanted to talk about the fact that as a paramedic, you should have a good understanding of what the profession is and how vital it is to people nowadays. Hopefully you understand that the next time you have an emergency situation and you dial 911, you'll understand what level of training and what type of care that people can provide for you when they arrive at your home. Again, my name is Glenn Carlson. I'm a paramedic firefighter for Palm Beach County Fire Rescue, and I'd like to thank you for your time.